Good day to all. In this video, I am going to demonstrate basic DRAF type 1 frontal sinusotomy. Before surgery, well orientation of CT frontal sinus anatomy and its drainage in related to anterior frontal recess cells and posterior supraovular cells and interfrontal septal cells is important. Here I am. After completion of bilateral anterior and posterior ethmoidectomy by using 70-degree endoscope, the first step in frontal sinusotomy is identifying the agonist cell and identifying of its middle boundary of middle terminate is important. And next step is a J curate is placed posterior to the agonist cell and the cell is broken in a posterior anterior direction. And third step is fragmented agonist cell is then completely removed using an Upton Blakesky forceps. The third step is after complete removal of agonist cell, the frontal sinus ostium becomes clearly visible or located immediately above and posterior to the agonist cell. Actually, the frontal recess boundaries are posteriorly anterior ethmoid artery and is shown here, which is lying just posterior to the superior attachment of the anterior wall of the ethmoid bulla. Here the artery runs posterior lateral to anteromedially within a mesentery at the skull base. So lamina papyracea forms the lateral boundary of frontal recess and middle terminate forms the middle boundary of frontal recess and anteriorly we have frontal peak. Here I am showing entire skull base on the left side from anterior to posterior. The same steps are followed on the right side. First step is identification of agonist cell. Second step is removal of the agonist cell. Next step is identification and widening of the frontal sinus ostium in medial and anterior directions. Care is taken to avoid injury to lateral boundary of orbit and posterior boundary of anterior ethmoid artery. On the right side also, the entire skull base is visualized and we can clearly identifiable all vital structure from anterior to posterior with 70-degree scopes. After complete bilateral pan sinusotomy, we clearly able to identify anterior ethmoid artery and posterior ethmoid artery and aortic nerves on both sides clearly. Thank you.